We want to thank everybody so much for telling your friends, for rating us on Stitcher and iTunes. Because of this, the podcast is really spreading. We're getting lots of great feedback, wonderful questions, and we want to show our gratitude. Every month, one person who rates the show on Stitcher or iTunes sends us a screenshot at botanicalbiohacking@gmail.com. Will be sent an herbal formula, a particular product that we personally like. Then at the end of the year, out of all of the people who send us a screenshot, we're going to select one name at random. We're going to fly you out to Sichuan, China to meet the farmers, the master herbalists, the martial art masters, and really come into our circle of friends. Meet us, see what we've been talking about with your own eyes, and experience some of the best in integrated medicine. Even if you don't have anything going on with you, it's just great preventatively to take care of yourself. It'll be a very beautiful experience, and we would be honored to have you with us. Hey everybody, today we have a great show for you. We have one of the world's top eye specialists in integrated eye care. He's a Chinese medicine and naturopathic doctor with books that are well received in the United States and within China. Dr. Andy Rosenfarb has an incredible background in eye diseases, specifically retinitis pigmentosa. He has some great advice for you today on how to protect your vision, especially in the age of screens. One of the reasons we made this podcast is to help relieve people from having to stare at yet another screen to get more information. He has some great tips to help us see better and preserve our eyesight longer as we age. Dr. Andy Rosenfarb, founder and clinical director of Acupuncture Health Associates in Westfield, New Jersey, is a world-renowned expert in the field of Chinese Medical Ophthalmology. Since 1997, he's been leading the field of integrated treatment methods that combine traditional Chinese medicine, naturopathic medicine, and new cutting-edge therapies to help people suffering from debilitating eye diseases to maintain and improve their eyesight. Dr. Rosenfarb earned his master's in traditional Chinese medicine from the Pacific College of Oriental Medicine and his Doctor of Naturopathy from Kenyon College. He continued his postgraduate education at Zhejiang College of Chinese Medicine in Hangzhou, China. Drawing from his extensive training and clinical experience, Dr. Rosenfarb recently teamed with researchers at John Hopkins University to design the acupuncture protocol for the first ever clinical study on the efficiency of treating retinitis pigmentosa with acupuncture. Dr. Rosenfarb is board certified in acupuncture and Chinese herbal medicine and is a founding member of the National Guild for Acupuncture. He serves on the board of directors for the American Association for Acupuncture and Oriental Medicine and is an executive council member of the Specialty Committee of Ophthalmology of the World Federation of Chinese Medicine. He is co-author of 2 books, Healing Your Eyes with Chinese Medicine and Ophthalmology in Chinese Medicine. The books he's authored and co-authored are considered the definitive guides for Chinese medical ophthalmology, not only in the United States, but in China as well. And now, without further ado, Dr. Andy Rosenfarb. How are you doing?
Doing great. Just really, just coming off a busy day and seeing patients and just really trying to settle down now and really looking forward to having a conversation. So glad to be here.
It's an honor to have you with us. To start off with, could you please tell us about your John Hopkins study?
Oh, yeah, absolutely. So, let's see. I'm going to guess about 6 or 7 years ago, some of my patients that I was treating with retinitis pigmentosa, which is a genetic or non-genetic, but it's kind of a genetic night blindness condition where people progressively lose night vision and their peripheral vision and their contrast. Contrast meaning that when they go from outside to inside, it takes a really long time for their eyes to adapt. So I've been treating this condition along with other eye conditions for the last 20 years. And some doctors at Johns Hopkins who see some of the patients that I see, we have some patients who are mutual, they had shown improvement. And it was 2 patients, 3 patients, 5 patients, 10 patients, 15 patients, that they were showing improvement. And the common factor was that they were all seeing me. After a couple of years of seeing that, they had a research team that reached out to me and asked me if I'd be interested in doing a research study. They had a few researchers who had already done some research on meditation and just other more holistic, I think, vitamins too, on different holistic complementary alternative, strategies. So of course I said yes, and they were. We had a great team. So what I had to do is I had to go down there and I trained an acupuncturist to perform the protocol because I'm up in New Jersey and it's, kind of a hike. So it wouldn't be reasonable for me to go down, for them to come up here or me to go down there. So we trained an acupuncturist. We went through the initial pilot study. We had amazing results. I was honestly praying for 30%. Because I know the magic number is like 22%, is placebo. So anything after that would have, kind of been a bona fide win. But we had something like 55% efficacy, which for, what we do is huge, especially for, as you know, in Chinese medicine, like a one-size-fits-all protocol without doing, detailed diagnosis. And for it was kind of a shotgun approach that we designed it. So we recruited, we had patients, and they got great results, and they published the study, and the results were so good that we got funding for a second study. So that started up and had similar results, and we're currently waiting for that just to be published, but that study was wrapped up.
And that's with the National Institute for Health and the National Eye Institute.
Correct. Yeah. I believe they gave a $250,000 fund for that study. I think it was $200,000 or $250,000.
Now, this is fairly detailed work. This isn't something I would recommend most acupuncturists just take a stab at, literally.
No pun intended.
No, yeah.
Yeah, right. So, but absolutely, I'm really glad you brought that up. And again, I promote training with that, and I'm very open to training acupuncturists, but it's definitely not something, for reasons you mentioned, and other. A lot of the locations of the needles in the study go extremely close to the eye. They're actually in the orbit. So you want to have some level of skill and proficiency when you're doing that. There's the internal biochemical mechanisms that you're going to have as well that can cause some problems. So yeah, we definitely want to have some level of competencies and skill in terms of training, that we want to make sure that people are doing it because they want to get results, but more importantly, like you said, we want to do no harm. You don't want to accelerate their condition or cause an eye stroke or something like that, or do something that's going to exacerbate the condition, which is not highly probable, but you can still do some damage. So yeah, training is in my opinion highly recommended.
I know in China, Chinese medical ophthalmologists are fairly sought after and difficult to find because the training involved is so extensive. How did you come into this? How did you kind of fall into this as your calling?
Well, it's pretty interesting. So when I was in acupuncture school, I think it's a 4-year program that I was in, and we had within that the entire program, I think we had maybe a 2-hour or 2.5-hour lecture. So that just sets the stage for how little of an education at the time. It's a lot better now, but there just wasn't the translations coming over from China. And when I was, again, in school, it was believed by most of my teachers and the people that I was dealing with was that eyes is almost impossible to treat. It was kind of insinuated, don't even bother treating eyes because you're not going to get any results. So I believe that was the reason we had such, minimal education. There wasn't a lot in books, a lot of the AAOM books, Acupuncture and Oriental Medicine books, the main texts. There was very, very little content and information on how to treat macular degeneration, glaucoma, optic nerve atrophy, retinitis pigmentosa, cataracts, myopia. In China, as you know, they've just been doing a lot of eye exercises to deal with this type of stuff, but there wasn't that much translated into the text in terms of information. So that frustrated me a little bit because I was having some patients with glaucoma and macular degeneration, not a lot, but a few. And my belief system when I came out of school was that there shouldn't be a difference in treating back pain and eye diseases. Now I've kind of grown to understand and study, a lot more the nuances and the difference, but that core belief that, hey, if acupuncture can help tennis elbow or back pain or somebody post-stroke or irritable bowel or fertility or whatever, why was I taught that it can't help eye diseases or some of the other complicated diseases? So that unwillingness to accept that as true led me to start researching what was out there for these patients. One of them was a very good guy. He was a kind of a mentor patient, if you will, in the regard that he just pushed me so hard. He kept telling me, I believe you could figure this out. You're smart enough. He was so passionate about getting me to do this, more so than I was. So he was an older guy, kind of a older Brooklyn, Bronx, son of a bitch type of guy,
Yeah.
just absolutely loved him. And he just had such conviction that I was going to be able to help him, and he just kept pushing me. So it was for him, I wanted to help him, and I learned as much as I could for him and my other patients. And at that time, I wasn't married, I didn't have kids, so I had a little extra time. I started collecting information from Europe, from China, from Japan, from anything and anybody, any resource I could get for anybody who had anything to do with treating eyes or had any philosophies or even theories about how to treat eyes. I was open. So I started collecting all this information and then siphoning through it, what seemed accurate, what seemed kind of bogus or made up. There's some of that in our profession too. There's, some stuff that I wouldn't say is kind of classical based. It's more kind of like an opinion about things. I had to kind of sift through what, felt true or seemed accurate for me, and just continue to sift through what was good content and what wasn't good content.
At that time, all of the good information was written in Chinese. How were you able to read it?
I went on one of these websites where you can hire people like Elance, and I hired some young Chinese students to translate some research articles that I found. I was like, look, I just got to get this content and this information. So I did things like that, kind of out of the box strategies to get what I can get about point locations and what they did and how it worked. So it was that type of, commitment to getting this down. And then after I had all this information, I realized that I had enough for a book. I said, well, there's no books out there on, TCM ophthalmology or Chinese Medical Ophthalmology. So let's write a book, kind of help the profession out. It was a void in the profession. Mm-hmm. So I put that together, wrote a book, and we had our first book, which was, I'm going to say about 11 years ago. That came out somewhere around there, 11, 12 years ago. And it's snowballed since then.
Vision can be fairly subjective. What kind of objective measurements do you use to measure results? At the time you started, there weren't the kind of MRI studies where people use a needle in the foot and it lights up the visual cortex in the brain. Vision in general is fairly subjective. People can say, oh, I think my vision's getting better, but what kind of objective testing do you use to really measure results?
When I first started treating eye diseases, it was like, oh, well, acupuncture increases the qi in the blood to the eyes. Probably. After doing research, we used ocular Doppler to measure the blood flow. We used ultrasound to see the increased blood flow to the eyes. We did visual fields. So there was actual before and after confirmation, third-party confirmation, but we actually saw real-time imaging and blood flow and increased. And some points actually did that, and some points didn't do that. So we got really, and this is what I get really excited about too, is the being able to use this diagnostic equipment to really show in real time what the effects of the certain acupuncture needles are doing on human physiology.
That's amazing, and it's so pertinent because we live in a time when so much of our lives, my own included, is spent in front of a computer screen, in front of a tablet or phone. It's never happened before in history. We really have no idea what kind of damage it's doing. Is this causing our eyes to age prematurely? And if so, what can we do about it?
Yeah, well, there's certain things that happen with age. Like pretty much everybody's going to deal with cataracts at some point. Everybody's going to deal with presbyopia, which is, your near vision starts to go. You have to hold your phone or your books a little bit further away. These are all just, the eye itself starts to dry out and loses its flexibility. So those things are kind of a natural progress, but there are other things, like you mentioned, that aren't so natural, or a consequence of overusing our eyes, or the recent introduction over the last 20 years or so of screens, of TVs, of our cell phones, of the laptop. And not only that, it's the amount of time that we spend on our tablets. Mm-hmm. So when I do my talks for my patients, we go over these three things. So there are three major things that happen that we need to be conscious of when we're on screens, when we're on computers, and when we're on tablets doing work or watching videos or something like that. The first thing is our posture. We tend to sit and jut our necks forward, and it's almost going to be I'm sure it's going to be a diagnosis, because I laugh at some of my chiropractic friends. They're working on a CPT code for tech neck, or an ICD code, because you actually, your neck goes it's supposed to be a natural C curve, but it kind of straightens out, but it's almost on a diagonal. So we really need to monitor our posture. And especially if you feel neck tension, drop your shoulders, roll your neck around. So that tension around the neck is not good. The second thing we do is we stare at these screens. I think we blink on average of like 40 times a minute, 30, 40 times a minute, which is normal. When we're on screens, it's like 6 or 7 times a minute. So we're staring and our eyes dry out. And the reason we blink is to moisturize our eyes and to clean our eyes. So if we're not blinking, our eyes are going to get dry, and we're going to get more bacteria and germs and airborne dust and danders and stuff like that in our eyes. So the cleaning mechanism is going to be more irritation. So that's the other thing. Make sure we're blink. So if you want to start a little, put a little sticky note in your upper right-hand corner of your laptop or your computer, or you can say breathe, blink, and watch your posture. And again, I just alluded to the third thing, which is we breath hold when we're on our computers or tablets or anything like that, especially if you're checking your email or you're looking at something stressful on social media or something like this. It's like, so our breathing isn't good. So that's going to create acidosis in our body and accelerate all kinds of stuff. So breathing, posture, blinking. Beyond that, there's the blue light that comes off the screens that is very, very harmful to the macula and the retina. 3 months ago, I just got a new pair of glasses, and I got the blue light protection on them, which I noticed an immediate difference. So even if you wear contacts or you don't wear glasses when you're doing computer work or anything, go get a non-prescription pair of glasses to wear when you're doing work at the computer. That has blue light protection. You can get it for like $20 online, and that'll help tremendously. The last thing is take breaks. I actually was talking to a young college student patient of mine who's in this week, and he's in his junior year of college, and he's on doing projects on the computer for 8 to 12 hours a day. So I was talking to him about the necessity to take breaks, 20 to 30 minutes, again, because you're not breathing, your posture is messed up, you're kind of rounding your body over a computer. Get up, 3 minutes, 2-3 minutes, take a break, walk around, stretch, move your body. But taking those breaks is also another way to help not only your eyes, but your whole body.
I remember in China, every afternoon, the teacher will lead the kids through a series of eye exercises. The kids do acupressure points on themselves. They massage the acupressure points like the temples and directly under the eyes. And it's supposed to help with the eye fatigue and help improve their vision, or at least decrease the rate at which it's lost. Based on your research, is there any validity to this, or is it just something they're doing to keep the kids busy?
That's funny. I was told the same thing when I was in China, and what I was told is the reason they're doing it is for some of the reasons we just talked about. Again, a lot of the eye exercises deal with the eyes, but also deals with the neck and the shoulders and keeping them loose. We want to, the eye muscles can get tense, and we have these different muscles that help our eyes move. And we have smaller muscles in our ciliary that actually open and close our lenses of our eyes and dilate them, and they help focus, kind of similar to how a camera focuses. So those muscles, when they get out of shape, like the rest of our muscles can get out of shape and weak or stressed or tense, we need to exercise those muscles like any other muscle in our body to keep it in shape. And as we know, with every decade that we age, staying in shape from a fitness perspective with our muscles becomes a little bit more of a challenge, and we need to exercise more regularly. You know, when you're in your teens or 20s, maybe you're playing sports, even if you're not exercising, you can kind of get away with it. 30s, 40s, 50s, every decade, you need to do regular exercise to keep your muscles and your nerves and your whole body, relatively healthy. And that certainly goes for your eyes as well. So the eyes need exercise to stay healthy.
This is slightly off topic. I have a buddy, Lars. Ever since I've known him, since we've been kids, his pupils have been more dilated than other people's. He's not high or anything, he's just always been that way. Women are always thinking he's in love with them, guys are thinking he's gay for them. And what's wrong with him? And more importantly, what can I tell him he probably has?
There's a couple of things. The first thing is, we know that our pupils dilate when we're in a relatively sympathetic state. So we have our autonomic nervous system, which self-regulates, like our heart rate, our breathing, our sweat, our digestion. So part of that system puts us into stress mode, which is fight or flight, and relaxation mode, which is called the parasympathetic nervous system. So when we get into a relative stress mode, and that doesn't necessarily have to be emotional or mental stress. It could be chemical stress or physiological stress. The pupils can dilate. So it could be something as simple as a lot of caffeine use, or just being somebody who's high strung, or it could be indicative of some other pathology in the body that hasn't gone diagnosed. I'll give you an example of one of my patients. A woman came in her mid-20s, and she had saucer-like dilated pupils. And a little bit high strung, but reasonably healthy, and just nothing really stood out. I was like, all right, maybe that's genetic. So a year or two later, she was going for blood work, and we found that her kidney levels were off. So we did a little investigation. The kidney levels were still high, the BUN and some of the other kidney markers. So we sent her for further testing, and it showed out that she had polycystic kidney disease, which is going to also affect the adrenal glands because they're on the kidneys. So that was the reason that she ended up having these dilated pupils. So with these conditions, when you see these symptoms, like in this case, a dilated pupil, it could be structural. It could just be a genetic. So, but you also don't want to not do full investigation, because it could be something else. And if it's like, especially if it's like one eye or not the other eye, again, it's usually nothing, but you always want to rule out things like tumors, even on the pituitary gland or on the optic nerve, or, something that are just so small. And I usually don't get patients worked up when I see stuff like that. We're talking about it now, but my bedside manner is usually, it's probably nothing, but I wouldn't be a good doctor if I didn't tell you to go check it out, and there's liabilities. So do me a favor and let's get this checked out. And again, it's probably nothing, but you still want to, not only just cover your rear end, or our rear ends, but we also want to do the best for the patient.
Absolutely. What is the strangest thing you've ever seen in your waiting room?
Yeah, so let me see. We've had quite a few. So as you know, we have patients who come in every week from all around the world for our eye treatments. I should count the countries, but we're up there. But it's awesome. And they connect, and it's not only the pleasure that people get from meeting people from other countries and other cultures, but it's also that they're connecting with people who have an eye condition like they have. Many of these people have never, ever met anybody who has an eye condition like they're dealing with. So when they come to the clinic and they connect, it's on usually a very, very deep level and usually very fast. And that's part of one of the things we really try to facilitate here is that connection that people make with each other who are dealing with this. And with that, we had 2 patients who happened to come in the same week from 2 towns in South Africa. They didn't plan to come together, but after talking in the waiting room, like I think it was the first day on Monday, they just started chit-chatting, and they'd actually seen each other multiple times walking dogs and just taking walks in the neighborhood and stuff like that. So it was pretty funny that they were in the same neighborhood together, but they came all the way to New Jersey to have a neighborly interaction.
That is crazy. It's such an extraordinary coincidence. Did you have an advertising campaign going on in South Africa? It's just so unlikely. How did these guys find you?
Yeah, we get that asked a lot. Most of my practice is word of mouth. We're starting to do a little advertising now. Not much. I'm not like a big advertiser, but it's mostly word of mouth. So somebody would come from South Africa or come from Australia or Russia or, wherever they're coming from. And they go back, they get great results, and they tell their friends or their family members, or sometimes they're part of a like Foundation Fighting Blindness or some type of organization that's like that in their country. So they'll go back to Brazil, for example, and they're on a Facebook group or something like that. And they'll start sharing their positive results. So, you're always going to get your critic, but there's always a few people that are looking for solutions.
What are some early warning signs that we may have a tendency to kind of blow off, but are early stage signs of potentially life-changing degenerative diseases?
Well, there are quite a few. Like anything else, if it's like kind of a spur of the moment, comes and goes, if it's an isolated incident, we usually say, okay, well, there's, you've had this or you had that symptom, and if you've never had it before and it came and went real quick, we'll kind of note it, but not really make a thing out of it. But some of the things we do urge patients to keep mindful of are floaters, flash it, like sudden big floaters that they'll get. Most people, it's kind of like a little amoeba, looks like a black amoeba in front of their eyes. A lot of flashing can indicate a pending retinal tear or retinal detachment. This is one too that I've found out in clinic. So I had a patient with glaucoma whose eye pressure was going up. Now, the thing with normal tension glaucoma is you don't feel it when the pressure goes up. And what this is kind of akin to is like a water balloon expanding. And when the pressure gets too big in our eyes, it could put pressure on the optic nerve head, and we could actually permanently lose vision. And there's no warning signs. That's why they call glaucoma is kind of like this silent thief of the night that comes in and steals your vision. So because there's no warning signs for that, one of the things that I've noticed in clinic is when patients, they'll be sitting up and they're fine, but if the pressure starts to get a little bit too high and they lay down, the pressure gets really bad and they feel like there's daggers in the back of their eyes. So if any patient's like sitting up, laying down, oh, my head's killing me. They sit back up, oh, I'm okay. Oh, they sit back, my head's killing me. So I'll usually send them right out to get their eye pressure checked. I've only had that happen twice, but that's kind of an indicator too. And anything abnormal, any pain, any changes, any blurriness, any darkness, anything that just is atypical, don't mess with your eyes. It's not like you threw your back out, you're going to rest it, it's going to be fine a couple days later. Your eyes are nerve tissue, they're photoreceptors. If something happens, that's it. So we really, you want to be preventative and just err on the side of caution and almost be a little bit hypersensitive to anything going on with your eyes.
Wow, that is such great information. It's so easy to take our eyesight for granted. And without those warning signs, it's something that can go unnoticed. What supplements out there would you not recommend to people because you think they're worthless? And which ones out there may have some merit?
Well, here's the thing that I've learned with supplements. it's not a good idea to take the latest thing that everybody's taking, or the supplement du jour. Kind of supplements and vitamins go through cycles of being really popular, and it's like this magic cure-all. Or recently, it's been like saffron and turmeric and stuff like that. I tend to go with things that are a little bit more researched, and at least I have an understanding of what properties they have and what they do and how they work on the eyes. So you almost never can go wrong with carotenoid antioxidants, which are like beta-carotene, lutein, zeaxanthin, and a lot of our supplements, Chinese herbs, have these properties in them. But it's not so much what supplement you don't want to take. There is garbage out there, for sure, and I'll get to that in a second. But you just don't want to take too much. You know, I have patients who come in literally. I had a patient come in 2 years ago with 4 grocery bags filled with garbage, 4 grocery bags filled with supplements.
With garbage.
And literally lined them up when she came in for a consult. She went out to the car and she was like, she came holding 2 garbage bags. She came out with 2 more and she's like, I take these every day. So again, you know, you want to kind of understand where they're coming from, and but that is going to put tremendous stress on the digestive system, on the kidneys, on the liver. So I'm kind of the way I see it is that's kind of like spraying, you know what I mean? And I'm a little bit more of a sniper when it comes to supplementation, meaning I really want to lock in a target and do targeted supplementation and targeted nutrition. I'd rather see you take 3 or 4 of like key supplements that we figured out are really good for you, based on what we know is going on with you, than taking anything under the sun that is good for an eye condition or any other condition.
My God, that's like a bowl of Cheerios.
Oh my God. I couldn't believe, how do you eat after something like that? Like, it was like a bowl of unreal.
That's incredible.
So, but there are poor quality stuff. And this is where I learned about this. So I started doing something called carotenoid antioxidant testing in my office, which basically tests your antioxidant levels. So there are some formulas that I had been endorsing and using as an eye product for years. And once I started doing this, it actually, one of the things it measures is how good the vitamins are and or how much your body's absorbing from them. So you eat the vitamin, you consume it, and it breaks down in your system and it goes into your tissues, it saturates them. Is that working, or is it just going through your digestive system? So some of the supplements that I found that I was endorsing were getting really low scores on these antioxidant tests. So, I had to call the manufacturer and the guy who created the product and like, look, love you guys, but, just FYI, you may want to remanufacture, because I would want to know that if it was me and my company. But I couldn't recommend that supplement anymore because it wasn't getting the results that I needed to. So it was like, oh, well, this has this thing in it and it has this, great formula for eye conditions, but there was either a binder in it or they were just outsourcing to some, crappy company that was selling them really poor quality vitamins and minerals. And my patients just were not showing that they had the optimal vitamin levels that they should, given with the doses that they were taking. So there is quality factor out there. And specifically, that's one of the things we found out for vision, is that this, there's all these antioxidants and everybody's looking for, the new great thing that's going to save their vision. But the best thing people can do to preserve their vision is make sure they have adequate amounts of these carotenoid antioxidants. And carotenoid comes from the word carotene. And so things like carrots or lutein, zeaxanthin, krill oil, astaxanthin. In Chinese medicine, we have goji berries. They're loaded and they're like the number 1 eye herb. And the reason is because they're so packed with carotenoid antioxidants. Actually, it's the most highly densely naturally occurring quantity of carotenoid antioxidants is goji berries. So
that's a great point. For those of you out there who want additional information on quality criteria for goji berries, please check out our podcast, Visual Acuity. There's an episode on there that would be very helpful. Also, if you want to try some ginseng and goji berries, we're going to give a canister of it to one lucky reviewer. So make sure to give our podcast a 5-star review, take a screenshot of it and email it to us at botanicalbiohacking@gmail.com. That's right, we have a Gmail account. We're that fancy. We'll send one lucky winner a canister of goji berry and ginseng powder. Can you give us some examples of how your work impacts people's lives?
We've had a lot of people get their driver's license back, of all ages, usually things like retinitis pigmentosa, Stargardt's, optic nerve atrophy. These are not age specific, as things like macular degeneration can be, or cataracts, or some of these more conditions that we think of would be, more of like 60s, 70s, 80s, seeing an onset at that age. So we have young moms, who have kids and they're, they need to drive and get their carpool going or go pick up their kids, and, they're borderline losing their vision, and we brought their vision back and they're driving, and some people were going to have to, go on unemployment, quit their jobs. We've had quite a few people be able to stay in their jobs because their bosses told them, look, if you can't see or you can't, perform the way we need you to perform, then you're not an asset to our team. We're going to have to let you go. So we've had countless patients who were facing losing their driver's license, facing losing their jobs, which is a huge blow to your income, losing family members. You have all types of emotional things going on with couples when they're losing their vision on both ends. You have the couples losing their vision. You have one person who's, thinks that they're just waiting until the other person is just going to let them go because of fear of rejection. They're like, oh, I'm losing my vision. They're not going to want to keep me around. They're abandonment. They're just waiting for them to kick out. And then the other person's like, oh, they're not opening up to me. They won't let me in about what's going on. I want to be the caregiver. I want to help them. So a large part of the work that we do are helping these people to emotionally deal with this, to talk to their caregivers, their family members, to their spouses, to figure out what can they do to save their vision so they can keep working and making money, or enjoy the things they like to do: skiing, hiking, flower arranging, painting, their arts. That's where your passion is. And that's where the real pain starts to hit. When you can't, you're threatened with this possibility of not seeing your children's faces or your grandchildren's faces or your husband's or wife's face. You're never going to see it again. And I'll tell you a crazy story that just came to mind because we're on the topic. I had a woman that I was treating for macular degeneration. She was in her late 60s, I believe, and she had actually gotten macular degeneration pretty early, was in her early 40s. So she's about 15 years into it. And she actually hadn't seen her reflection in the mirror or anybody else's face for about 12 years. So after treatment, she did amazingly well, like really just had an unbelievably positive responses. And she kind of freaked out a little bit because she saw herself in the mirror.
Oh my God, you aged her 12 years.
I aged her 12 years. So as happy as she was, who's that old lady I just looked at? And she was very funny, but it was a shock to her. She was like, I haven't seen myself. Her hair was different. She had a couple more lines, really, beautiful woman inside and out. But it was like, she basically went in a time capsule and came back 12 years later and saw herself and her husband and her kids and her friends. So it was those, seemingly small nuances are just such a big deal. So it's such a quality, it's a real qualitative issue that comes to be such a devastation for people dealing with these conditions.
Wow, that is such a blessing. If you want to find Dr. Rosenfarb, go to www.acuvisiontherapy.com. You mentioned that people fly in to see you. Do you have a system where you help set people up with local hotels? How do they do this? What could they expect, and what kind of results do people enjoy?
Yeah. So the majority of our eye patients who come, well, actually, I'm not majority because we have just, there's only X amount of people who live in the New Jersey, New York tri-state area. So they basically come in. We've tried to condense the treatments so people can get a series of 10 or 20 treatments, even up to 30 treatments sometimes within a relatively short period of time. Usual acupunctures, for most conditions, maybe 2-3 times a week. That will require people to come and stay for 3 to 4 months at a time. We found that by compressing the treatments, doing, sometimes 2 treatments a day, even up to 3 treatments a day in some cases, will get very, very fast results. So what we do is we do vision testing, and then we treat patients for that week, Monday through Friday, and then we retest vision. So we're looking for measurable results. It's great when patients tell us they're seeing better, things are brighter, the colors are better, my visual field's better, but I also want to see something, tangible. I want to see objective findings that show vision improvement. So we look for both of those. Patients will come, they'll stay in a local hotel. There's Airbnbs in the area. They usually stay for 1 or 2 weeks. And it's Westfield's a great area. It's a cute little town. There's a lot of people like to go shopping. A lot of people go into Manhattan. They go to New York City, so they make a trip out of it in the summer. They go down to the Jersey Shore and see Snooki and whatever else they're going to do down there. But it's a great area, so people like to come, kind of hang out.
One thing you're known for is being very honest with what is within and what's without your scope of practice. There are some diseases that you're just miraculous with, and some that you can't really touch. And what I've heard about you is that you're very forthcoming with what you can and can't treat. How can people find out if, based on their condition, how far it's progressed, if it's something that you can help with, or whether it might be a little outside of the scope? Do they have to fly in and see you personally before they can know this, or is there some way they can do a consultation to find out if it's within reach?
I do free consults for my patients. That means they could call me or email me. I offer that to anybody, and I kind of throw it out there like, look, I know if you're probably going to be a responder or not. So if you have questions, reach out to me anytime. I'm always available, and I'm always available to answer questions. If you're interested in what we're doing, or you're not sure if this is for you, ask. Let's have a conversation. If it's not for you, I'm going to tell you it's not for you, and I'll tell you what I think will help you.
Brilliant. Well, thank you so much for coming on and sharing with us your 20 years of experience and wisdom so we can get an idea of what else is out there.
My pleasure. I really appreciate you having me.
Likewise, this is really information we couldn't find anywhere else. When you have a few minutes, I suggest you go to YouTube and look up Andy Rosenfarb. He has a YouTube channel where you can get a better idea of his method, and you can see patient testimonials. You can see videos from people who used to have very bad vision, and they're seeing quite well right now, and it's quite extraordinary. It's always a pleasure to see someone so dedicated to their craft, putting 20 years of, passion and curiosity in one direction. When you get that kind of laser-like focus in one direction, oftentimes very good things happen. We hope to have some similar experts coming soon, people with unique and very dedicated areas of expertise that may not be on your radar. If you guys want more information, check out the show notes. We try to pack little Easter eggs in there. If you want to know where to find products or references, we try to put them in there if they're in English. Also, thank you so much for all of your reviews, and please keep telling your friends and family, get them to review, rate us, and send us the screenshots so we can send you these amazing prizes. Teas, products that we personally use in daily life that are generally safe for everybody. These are the kind of things we're going to be sending out. And remember, at the end of the year, we're going to fly one of you out to Sichuan with us. We appreciate everyone who's reached out to us, whether it's just to say that you've enjoyed the show or to request a specific topic or to have a certain expert come on and speak. We're listening very attentively and we're working on it. We're taking the most common questions and forming them into future podcasts, and also reaching out to our friends who are experts in very specific fields to help bring their expertise on here to help share that with you as well.